If you have had a knee replacement surgery, you have probably been told to do heel slides. This is a very popular exercise to do in the early phases of your recovery. From day 0 to 14, heel slides are very useful, but they can be really painful. Even as simple as heel slides are, they can be really hard to do and really painful. So I'm going to give you some tips in today's video to make the heel slides a little bit easier. If you are new here, my name is Dr. Samantha Smith. I am a physical therapist and a knee replacement specialist. So all my videos here on YouTube are dedicated to knee replacement recovery tips and tricks. I also have a website, succeedcourses.com, where I teach online exercise classes. I have educational courses, all to help support you pre and post knee replacement surgery. Also have a free Facebook support group. If you aren't in the Facebook support group, highly recommend joining. It's a great group of people. You'll realize really quickly that you are not alone in many of the symptoms that you are experiencing. So just go to Facebook and search Succeed with Your New Knee to join the free Facebook group. Now, heel slides are really painful after surgery. That's because obviously there's a lot of damage that has gone on during the knee replacement surgery. There's a lot of pain. There is a lot of swelling in your knee that makes it really tight and hard to bend. The reason why we give heel slides so early on post-surgery is we want to start getting the knee moving right away. We don't want you laying with your knee just straight out in front of you for weeks and weeks. It is going to stiffen up on you. So the general recommendation is to get that knee moving even day 1 post-surgery. So heel slides are tough. Some people like them and some people completely hate them. And I find that most people do hate heel slides, and some of these tips can really help make the heel slides more tolerable. So first thing is using a plastic bag. So you're just going to wrap the plastic bag around your foot, and you'll want to tie it tightly around your ankle so it doesn't slip off. And you can do heel slides with the plastic bag around your foot. It makes the sliding much easier. You'll have less friction when you do it with the plastic bag. So this is kind of tip number 1 here. Another tip when you're doing heel slides is actually to lay all the way back flat, or at least you're not in this upright kind of long sitting position. You want to lay back as far as you comfortably can and then do the heel slide. So that's going to put your hip in a different position. It's going to make the exercise just a little bit easier for you. Another tip is to grab some sort of strap. So I have this yoga strap, got it on Amazon. It's by a company called Deer. They make really great yoga straps. You'll put the strap around your foot. You grab these loops here with your hands, lay all the way back, and then you can use your hands to give you a little assistance, a little pull to make the heel slides easier and to get the knee to bend. And to make it even easier, you can keep that plastic bag on your foot while you're doing the heel slides with the strap to make the exercise even more tolerable, hopefully with less pain. So I find most of my patients do not like heel slides at all. When this is the case, I have them switch from doing heel slides to just doing a basic seated knee bend. So let me show you how to do that next. A seated knee bend is exactly what it sounds like. You're going to sit in a chair. You want to sit at the edge of your chair, good upright posture. You're going to place your foot on some sort of device that's going to slide back and forth. If you're on carpet, if you're on hardwood floor, you can just use your sock on the floor instead. So what you're going to do is just slide that knee all the way back. Hold this position here for about 10 to 20 seconds so you can get a good stretch in, and then kick that foot right back out in front of you. So the paper plate on the floor is going to help you slide a little bit better on the carpet. You can also use, when I do home care physical therapy, so I use the discharge folder that you get from the hospital. I'll put that under my patient's foot and we'll use that to slide the leg back and forth. That discharge folder comes in handy after your surgery. That can be really helpful. Anything that's going to help you slide the foot back and forth. So if you are finding heel slides laying down is too uncomfortable, you can try seated knee bend instead. Now, I go over all these types of tips and tricks in my educational courses. If you are fresh out of surgery, highly recommend joining my post-surgery course to help you right after surgery. If you are struggling with knee bending and you've been stuck for several weeks, I also have a new knee bending course that is dedicated to getting your knee bending after a knee replacement. So if you like this video, please subscribe, comment below with any questions that you have. If you want to get a hold of me directly, you can send me an email at drsam@succeedcourses.com. Thank you so much for watching, and I'll see you again next time.